I think we're expecting a couple more people to join, so we'll give folks a few more minutes to sort of dial in, and we'll kick off in just a couple more minutes. All right, why don't we go ahead and start out, and hopefully folks will join us as and when, and they'll jump right on in. So I suppose just to kick things off, I'd just like to say hello. My name is Claire Fitzgerald. I'm a research fellow here at the Government Outcomes Lab, and welcome everybody to sort of the second iteration of this newly formed Emergency Responses in Government Outcomes, or ERGO, peer learning group. Thanks, and I'm glad all of you are here to spend some time with us today. I mentioned this on last week's call, but for the benefit of some new folks, I'll just provide a bit of background, or a brief background, about how we got here. So GoLab set up ERGO to have this sort of shared platform for those in government, provider organizations, and academia, amongst other sectors, to sort of share their experiences of emergency and disaster response and recovery. And this is supposed to include, but not be limited to, COVID-19. So we're trying to reflect here on some wider implications for outcomes-based approaches. I also flagged that ERGO is meant to be a very emergent and responsive peer learning group. And so we're currently sort of developing what future sessions of ERGO look like, and are very, very open to suggestions from you all. You'll see details of the upcoming session at the bottom of the agenda that were circulated earlier today. And that is on the 22nd of April. We'll be discussing sort of performance and accountability during COVID-19, particularly ramifications for data sharing, monitoring, and auditing in crisis contexts. I also flagged that we're sort of trialing out two formats. So the one I just mentioned is one of these kind of more structured, curated conversations. The one today is very different. It's more participatory, there it is, and a bit less structured. We'll talk through exactly how we hope it's going to work today, but we appreciate everyone's sort of patience and willingness to jump right on in. Likewise, in terms of outputs from the sessions that we're running related to ERGO, written and otherwise, we are still very much thinking about what these look like. But for now, we'll be circulating notes summarizing the conversation today, and really trying to get those circulated as well to relevant decision makers, both in governments and the world over. Similarly, any policy briefs or memoranda that we sort of develop on the back of conversations that take place in ERGO sessions, we'll also share with participants. And I just want to give you all the sort of heads up that we are recording sessions, including today's, to enable some of that drafting to occur. So I also hope that the sessions are valuable, and that you sort of stay involved in ERGO by continuing to join these conversations and calls, as well as helping to shape the sort of wider group, whether it's joining us as a speaker on a future call, or letting us know where we've gotten topics really on point or not so much, or where the formats perhaps could be improved. Again, I like to always say we're experimenting a bit with this one. So please be patient, but also please send through your participation or your feedback and continuing to the group should serve you. I'm getting a bit of feedback, so I'll just double check to see if folks are muted for right now. Awesome. Also, for feedback, you can sort of look at the details at the bottom of your agenda, and that can tell you where to send things. So let's talk about what we're doing today. So today is all about taking on the questions and comments you've fed in on the back of both last week's session, as well as what you had shared with us when you registered for today's session. So we've kind of got three chunks to the agenda, as it were, and you'll see these articulated sort of as objectives. So first of all, basically because we ran out of time during last week's call for discussion, we'll start with a bit of a recap on the themes which emerged. And after that, I'll invite you all to pose questions or comments to the group. Then we've sort of teed up presentations from two projects who will be giving us a bit of a snapshot around how their work has changed in light of COVID-19. And the focus will be on the ways that service implementation and delivery have been altered, what the major challenges have been in implementing what those changes have been, and what they anticipate sort of their next set of challenges and big decisions likely being. And then at sort of the end of the session, we'll see if we go for an hour and a half, maybe it'll be shorter, but we'll see what the sort of temperature of the room is. At the last step, we'll kind of move to some of the questions which were submitted in advance of this session, and we'll invite responses from the wider group on some of those questions that you all sent to us. So I think in order to cover the things that I've just outlined and really keep discussion moving somewhat smoothly, I see we've got about 30 people on the line, which is kind of big to just let this be a bit of an open free-for-all. I do want to sort of set up some norms here and expectations for the way the open sessions are going to run. Under normal circumstances, we would try to do these in person. And I think it is hard to recreate that sense of holding space for everyone's views virtually, but we're gonna try it today. And so what this means is that I'm gonna ask you to keep in mind the following three things as everyone engages in a bit of discussion. The first one of those is just like, whoever comes are the right people. So everyone on the call today is here because they really care about what we're talking about. And so this means that everyone in the room is precisely who should be here because they're in a position to initiate action and exchange learning. I also want to suggest that whatever happens in the room today is exactly what was supposed to have happened. And I think it's great if we can all do our best to focus on the present time and place rather than getting bogged down in what the conversation should or could look like. Instead, make those should haves or could haves into suggestions for what subsequent meetings can be. And feedback to myself or to Andrea, again, via the details at the bottom of your agenda. Lastly, I also ask that everyone takes the responsibility for what they care about and engage and participate accordingly. The open sessions are not meant to be venues for everyone to just download information passively. We really want this to be an opportunity to exchange information and be reciprocal in the way that folks engage with one another. So I encourage everyone to jump in and participate in whatever way that you kind of feel comfortable with. So in terms of how that participation is going to look today, these sets of norms are far less maybe lofty sounding and a bit more around operational realities of trying to navigate a group of 30 people online. I'll ask you to please keep yourself muted unless you're speaking. I'll also ask that you refrain from interrupting people while they're speaking. I would also say that if you would like to speak, please use the raise hand feature in Zoom and I will invite you to speak. And the way you raise your hand in Zoom is if you go to participants at the bottom of your screen, you'll sort of click on that and then you'll see an option to raise your hand. And if you want to no longer raise it, you can also lower your hand. When you do speak for the first time, it'd be great if you can take the opportunity to tell us who you are, what organization you're with, and then clarify sort of what point of view your question or comment is coming from. I'll also try to monitor chat functions as well. And so if I see things popping up that feel relevant, I'll try to feed those into the discussion as we go. And then lastly, I will try to get to as many folks as I can. I will undoubtedly miss raised hands and comments, which I apologize for in advance, and I will try to get better at it as we all do this together. So with that, let's go ahead and move into a sort of recap and the discussion of themes that emerged from the first session of ERGO last week. So I think many of you were there, but just as a sort of, let's get everybody on the same page, singing from the same song sheet, as it were, we really looked at changes in projects that address complex social problems, primarily those based on outcomes, like impact bonds. And we asked speakers to address three kind of questions as they shared with us their point of view, whether it was from a central government, whether it was a sort of provider or investor perspective, or whether it was coming perhaps more from the finance side of things. And so we asked, what is guiding the response to COVID? Is it contract terms? Is it laws and government? Is it emergency policies, or is it relationships? We asked about our responses. So do we pause? Do we sort of try to keep walking, or do we try completely new and different things in the immediate term? And then also, does that response look different when we sort of push out the time horizon? And then we also asked about any promising practices. And so I noted three sort of overarching themes which came out of the discussion amongst the central government representatives and lawyers, which speak to those three questions. You'll see them articulated as three themes in the agenda. The first, in terms of what is guiding our responses, was that we heard a lot about how the importance of relationships must sort of be center focused, so that it's relationships perhaps over and above contract features. And the consensus seemed to be that a key element of contracts is that they're designed to keep a deal together rather than dismantle or restructure a project. And so we also had some commentary similarly on the government response, mostly about a series of public procurement notes which have been sent out from the UK Cabinet Office. And the government position largely seems to offer providers flexibility and preserve service delivery where possible by offering payment on more flexible terms. And in the case of the Life Chances Fund, which we heard about, this was sort of articulated as the option for projects to receive assured payments for the next several months, where some form of service could be continued, or press pause and negotiate further what the implications of that pause might be for a particular project. Likewise, on the call, we also had a couple voices that stressed the need for sort of rapid understanding of a new normal and suggested that what was needed is a sort of rigorous and specific understanding about what has changed in relation to particular contracts. This was articulated by Ranajoy as sort of problems of cash flow, problems of implementation, or problems of measurement. By others, it was perhaps a question of really trying to understand whether the needs of a particular cohort had disappeared, had been delayed, or if they'd been transformed. And in either case, the key elements to the decision of whether to change outcomes or services seem to be a sort of rapid assessment amongst stakeholders of what exactly needs to change, and then mobilize accordingly. There needed to be a sort of prioritization and parsimonious decision about how that change should be enacted. But sort of the maybe bigger health warning around some of these changes was that we shouldn't let COVID-19 be a reason for retreating into old ways of contract working. Which I think for me sort of finally opened this other theme around the idea that COVID-19 perhaps presents an opportunity for things to change in the future. And that was highlighted actually by a couple of folks on the call. And that effectively there are these perennial shortcomings of public service contracts, chief among them perhaps that contract terms which relate to flexibility and working relationships are underdeveloped. And as we work our way through this together, perhaps this is an opportunity to improve on the way that we contract sort of moving forward, perhaps not during a pandemic. So with that sort of summary of themes that came out of the conversation, I suppose I'll sort of kick things off and see if anyone has a comment or question related to some of the themes in the agenda. What I'd like to do is work our way through these in order. So we'll tackle maybe theme one, which is perhaps diagnosing some of the problems that you might be experiencing around cash flow implementation measurement, but really trying to be specific about the contextual realities that you're facing. And again, I'll go ahead and invite raised hands to speak and try to feed in comments as I see them. So I see Rory's hand, so I'll go ahead and see if Rory's got something he'd like to kick us off with.
Yeah, thank you, Claire. So in the last session, I mentioned something that I thought was, three things that I thought was important. The idea that there are new things happening and new outcomes potentially. The idea that governance and inclusive governance was important during changes, and the idea that tracking costs were important. But specifically related to this theme, I wonder, I'm aware that we're dealing with outcomes-based contracts, so our performance now affects payment and has cash flow implications for the future. I wonder if some of the emergency procedures that we're going into are complicated by that sort of performance is happening now, but payment for that performance will happen when outcomes happen in the future. I see there being sort of two potential complications. A lack of awareness for the reality that change has a cost itself. As we're working out what the changes should be, there's a cost associated with that. This conversation, other conversations, and what and will those costs be covered sort of under emergency procedures would be something that I would ask. And the second thing would be that if we are just taking money from the outcomes that would be sort of paid in the future and just shifting that money now, then that is going to cause a problem in the future. And I think Daniela sort of pointed that out, and others pointed that out. So that's what I'm looking for, sort of answers to the concern around performance now, payment later, and those two potential complications.
Excellent, thanks, Rory. So yeah, I'm hearing questions around how folks are grappling with an awareness of costs and how those might be sort of shifting over time, and what problems might be associated with pulling some of those costs sooner rather than later. Yeah, I'm curious to see if anybody's got some thoughts on that. I imagine folks are grappling with sort of similar issues in their own projects, particularly as I think about redefining outcomes terms and whatnot. I should flag also that I'm relatively comfortable with silence, so I would jump in if you've got any semblance of an idea here.
I mean, I'll say one solution that would come to mind would be tracking what costs are happening now that are related specifically to the change, separate from outcomes, and I wonder if anybody's paying for those costs or getting funding for those costs separate from any changes that would need to happen to the existing outcomes. So as opposed to shifting the whole thing to service-based, doing sort of paying for the services related to figuring out what the new outcomes look like.
Louise, can I bring you in?
Sure. So I think, and I'm conscious that my colleague Hortense, who is running the program in the DIB program in Cameroon that I'm part of, is also on the call, so has particular views. But when we've been looking at some of the financial costs around this, I think we're in the context of the program in Cameroon, I think we've been finding that there are as many potential savings from travel and in-person kind of visiting to sites as there are potentially additional costs. It's a hospital-based program around additional safety equipment and potentially the need to provide private transport for patients that we hadn't previously budgeted for. So we're still working through some of those financial implications, and that won't obviously be the case for all programs. But I think you're right, Rory, that we're tracking very carefully, but in both directions, both in terms of where there are additional costs, but also where there are potentially savings, because the model that we had planned for had a lot of face-to-face contact and therefore a reasonable amount of staff travel budgeted in.
Hi, this is Juliet Keeley. I work for Instiglio, which is a consulting organization that focuses on results-based financing. And we have a performance-based program that was about to launch in Morocco around workforce development. And 8 service providers were being paid partially on their placement and retention results. And all 8 service providers have stopped their activities because they involved training people mostly in person. But there is some pre-financing that had been unlocked for some weaker, in terms of capacity, service providers. And that pre-financing is now being unlocked for every service provider, regardless of pre-existing capacity, because so many have recruited staff that need, at least temporarily, on call, so that they can restart activities when movement is allowed in the country. So just to give you an example.
Cool. So I'm hearing actually quite a lot of maybe where people are finding savings in existing budgets to sort of reallocate those across outcomes profiles as needed, as a way to keep things up and running. I think too, let's go ahead and maybe folks have some comments on how they've navigated some of those calculations. So switching over perhaps to theme 2 a bit. So when we talk about the relationships versus the contracts, how have you gone about making discoveries about the projects themselves and making decisions about how you begin to change and adapt delivery and practice? Have people found themselves looking at contracts, or are they in fact looking at people across the table thinking to themselves, oh God, what do we do now? Well, how do you foster these kinds of conversations? Yeah, Steve. I've got a hand up from Steve, but I think you might be muted.
Thank you.
Yep.
So my name is Steve. I work at the Elton John AIDS Foundation. We have a project across Southeast London, and it's particularly around bringing into early diagnosis people with HIV and bringing back people who have lost to follow-up. In other words, people who have been off treatment for 1 year or more. And one of the things that we've been doing is to look within our existing partners to see if one partner has capacity to pick up on the activity that would have been previously in a different partner. So we have a contract with GP federations in Southeast London. They're obviously extremely busy at this moment in time, but one of the HIV charities that we have been using in one way is potentially going to be able to position itself to pick up some of the loss to follow-up follow-ons that would normally have been done by the GP practices. So there's something about bringing in or thinking about the roles when there are multiple partners and seeing if there's room for some renegotiation as to which partner has which role.
Thanks for that, Steve. I think interesting that folks are perhaps looking to leverage their existing partnerships in new and different ways. Hortense, I see your hand up.
Yes, thank you. This is Hortense. Louis spoke about the project. It's a development impact bond for the care for preterm and low birth weight infants in Cameroon. And here is just to say that we are looking both at the contracts and the different stakeholders, as it depends on both of these people in the way we are or we are managing the crisis. Because whatever decision that comes out of this needs to go through a contractual process. And so the contractual mechanism, we're looking at the mechanism, we're looking at the force majeure clauses, and we're looking at what that gives us and what can we leverage based on what was agreed at the beginning. And speaking to all the different stakeholders, some are having different approaches about how they want to handle this. And we're trying to find common ground and finding the place where everyone feels like we can still continue to deliver the services, even if it's a slowdown, because the service is still much needed. So I would say that we are looking at both in this case.
That's really helpful to understand that it's about perhaps really understanding what was agreed to at the beginning, but then thinking through how you adjust and adapt in real terms. Julian, I'm aware that on the call last week, you made a number of comments around perhaps the sort of underdeveloped nature of some of these flexibilities in contracts. I didn't know if maybe you wanted to talk about in more detail what you meant by that underdevelopment, or how exactly people should be thinking about leveraging some of these governance mechanisms.
Okay, thank you. Well, what I was really saying last week was that a lot of the issues that are being talked about in relation to crisis have only, really been magnified by the crisis. They've existed for a very long time before that. And I gave the example of a reaction to transforming rehabilitation, considered not to have been successful. Why wasn't it successful? It was expecting to have social investment. Social investment wasn't attracted to the degree that was anticipated. Why? It was thought that there was a reluctance on the part of social investors to invest by reference to the capability of organisations rather than strong balance sheets, for example. That was the way the question was phrased. And the social finance institution replied, no, it wasn't that at all. We're very happy to invest against capability. What we couldn't do was investigate against a contract that had unilateral rights to vary that are inherently insecure, insecure for the provider, insecure for the investor. Now that's a fundamental defect in contract, and it's one that I mentioned in a campaign paper I wrote in 1999. And there were various other features of that campaign paper, such as contracts are too short term to allow for service development. Contracts are unbalanced and one-sided and not treated as if they're mutual working relationship arrangements. And pricing is probably the biggest one of all, picking up on Rory's question about costs. Pricing, generally speaking, is not fair. I mean, it's not related to actual cost. There's a in different areas there's been an expectation of some level of, in effect, subsidy coming from the provider. So I was really saying that those are basic contractual things that are brought into very sharp relief when you're thrown about by something unexpected and as extreme as this. The government procurement relaxations, I don't think they're relaxations. I just think they're suggesting a better approach to contracting. So take the pricing point. In that PPN, it talks about as if it's law, as if it's a rule that you only pay in arrears. Well, a lot of providers would welcome cash flow benefit of being provided with the payment at an earlier stage. Why not in advance? The principle of you only pay by reference to when the payment is needed, that is consistent with payment in advance. The PPN says we're going to relax it and we're going to allow payments in advance to ease cash flow arising from the crisis. My point is that's just good commissioning practice. It's not something that needs to come out of the crisis. And so there's quite a lot of points along those lines which make the issue for the crisis, in my opinion. We can now all see what these issues are. Those that could see them before, those that needed to recognize them before, we can all see them. We all need to react to them with flexibility now, and that's apparently, generally speaking, happening in a way that it hasn't happened in previous years. And the absolutely critical thing, apart from just reacting to the crisis, is to say, so now we understand what makes these contracts work better. And what we need to do is to consolidate those, capture those, entrench those. So these good contracting practices that create good contracting relationships that are focused on actual value delivered and real outcomes, and most fundamentally of all, the actual needs of the services are being delivered to, all of those things become sharply into focus, and we change our approaches going forward by reference to these issues. And in relation to outcomes, the point I want to make about outcomes, and I'm never quite sure whether it really has any resonance or not, is that outcomes in the sort of SIB, the sort of strict SIB type approach, are all about you get paid when you deliver the outcomes. And that's fine as a principle, in that payment as a sort of benefit sharing arrangement. You can say, so if we really organize this well, we deliver a service well, we solve things, we save costs, the costs come back. And that's an excellent principle, but I don't think it's a substitute for paying for the service per se. So you pay for the service, you organise the service really well, benefits are derived from the service, and then there are, in effect, surplus or profit sharing arrangements that come out of it at the end. And that can be a basis of a really positive agreement. The commissioner can share in it, the supplier can agree, strengthens the supplier for being a supplier of excellent service. So I just think, loads of issues about contracting practice, loads of issues about procurement practice that we need to learn from now. We absolutely critically have to. And specifically into outcomes, it's not just about paying for outcomes, it's about outcomes as part of an overall sophisticated contractual arrangement, which should really be thought of as a partnership.
I think that's really helpful. What I'm hearing as well is a lot of the comments around some of the improvements on contract terms perhaps have to do with assuring or understanding the cash flow implications for services, and that in an outcomes-based contract, that cash flow is not just predicated on paying for outcomes, but indeed compensating for the service itself. Rory, is your hand back up?
It is, sorry.
Okay. Yeah.
I forgot to introduce myself as a lawyer based in New York, but a research associate at the Go Lab, and I coordinate the procurement of government outcomes group, which is chaired by Anne Davies, who's the Dean of the Faculty of Law. But I wanted to directly address this issue of like contracts versus partnerships. Obviously as a group of, there are many lawyers in the POGO Club, and as a group of lawyers, sort of the instinct is to go to the contract and see what does the contract say. And I think the group's reaction is how unhelpful the existing force majeure clauses are. Force majeure is sort of like act of God, act of people, that have something that's fundamentally happened that doesn't allow the performer to perform, and creates sort of a period to address that. This is unhelpful for a number of ways, and so we are looking to partnerships to figure out change. It's unhelpful because there are more than one contract to play. There are lots of contracts in these sort of collaboration projects that we're dealing with here. We know there are multiple parties, there are multiple contracts, and there are inconsistencies. Fundamentally, this is about services not being performed. We are talking about outcomes. We have given people more flexibility to do things in the immediate term to allow them to focus on outcomes. So force majeure as a service-focused thing doesn't quite fit. And thirdly, there's new value in the partnerships, in the networks that's being created that nobody, I think, in this emergency wants to lose. Governments are thinking about new ways to maintain employment, new ways to maintain networks. So a sort of shutting down of services at this point in the emergency, it seems counterproductive. And so something like a force majeure, which is about shutting things down and figuring out what can be done, doesn't seem like it's appropriate or fit for purpose in a world where we are trying to come together and figure out how do we change. And so governance clauses around change and making sure the right people are at the table seems to be a more appropriate sort of place to look at in the contract. But even if the contract is not working or not appropriate, the parties can always come together and come up with new terms, new agreement to address what's happening now and may happen in the future. Would be my sort of take on the thoughts that the lawyers in the POGO group are having.
I think that's really helpful to make that distinction between the sort of contract and the partnership in mind. I've got two hands up. So what I'll do is go to Louise and then Julian, and then actually we'll move into the next segment of the conversation today. So Louise, over to you first.
Yeah, thank you. And I realise I also forgot to introduce myself. I'm Louise Saville. I'm a director at Social Finance based out of the UK and also a visiting fellow of practice at the Blavatsky School. I think Rory, what you're saying resonates, and I think what we have seen both in the partnership that Hortense will talk a little bit about in a minute, which is the Development Impact One for Neonatal Health in Cameroon, but also in some of our other UK programs, is that people are coming together as a partnership first and are agreeing a set of principles ostensibly around how they want programming to continue. And I think, you know, in some cases, that programming may not be possible to continue. In the case of babies being born, we know that premature babies and low birth weight babies will continue to be born through the pandemic, and therefore actually, if anything, I think all partners are seeing this program as being of greater importance rather than of lesser importance than before the pandemic hit. I think we have tended to see people coming together really not disregarding the contract, but putting it to one side and focusing instead, I think, on two things. One strand of thinking is around the sort of operational practicalities. Can the program logistically continue to be delivered, and what are the constraints, be those around travel or around clinical access, that we need to consider, and how can we pivot essentially to continue to develop and deliver some of the outcomes we've been planning to, with those operational constraints in place. I think the second set of constraints that we're really having to contend with in a lot of our programs are then around the outcome verification processes, where I think particularly where those processes have relied on face-to-face contact, interviews, observations of practice, those are potentially quite difficult to sustain in a context of social distancing. And so I would say that we're sort of seeing partners come together to try to pivot on multiple fronts simultaneously, both to redefine what good looks like and how good will be measured within the context of the new constraints, and also to think together around operationally, what is it possible to continue to deliver. I think, you know, I fully agree with you that, you know, governance and the governance clauses around the extent to which these contracts can be amended and who has the power to amend, and who needs to be party to those conversations and how those need to be documented in order to give them, I guess, legal force. I think it's feeling like it's much more important than the force majeure clauses within the contract, which are very binary for the most part. They're termination clauses, and that's actually not the mindset that anyone is coming to these conversations with at the moment.
Thanks for that, Louise. We'll definitely return and try to crowdsource some solutions to the sort of outcomes verification question where you're no longer doing things face-to-face. Over to Julian, and then we'll move over to some of our project kind of descriptions and explorations. So Julian, last word for you.
Thank you. Yes, I also forgot to introduce myself. Julian Blake, public benefit lawyer, Stone King LLP. Picking up on Rory's point about force majeure clauses not being particularly helpful, maybe we've had a discussion about this on these calls before, and kind of agreed that it's not really important whether you call it the force majeure clause or you call it we need to talk. You need to talk and you need to work things out. And I'd take it a step back from looking at the force majeure clause, right back. I took the first contract I ever looked at as a newly qualified lawyer, public service contract from a UK county council. I looked at that and I thought it was absolutely appalling, because it was just a commercial contract, pure commercial contract without any real concession to the subject matter. And I would say a lot of the public service contracts still look like that. And so the issue isn't about the force majeure clause, it's about the attitude of mind behind the contract, which is a commercial deal, as opposed to a two-party, or in a SID case, a three-party common purpose working relationship to deliver, and essentially in a collaborative approach. One party's putting in the commissioning requirements, one's putting in the service requirements, one's putting in the money, and they're all trying to deliver according to a common purpose. They're all trying to deliver the public benefit value that comes out of that. Now, if that's the premise, as opposed to it being a commercial deal, then really you'd write the thing very differently. And very specifically what you'd write differently. Well, obviously you'd write the specification differently, because you'd really focus on that as the only really important thing. But the other really massively different thing you would be doing is you'd be looking at how you articulate the relationship. And so, for example, a commercial contract will have a dispute resolution clause that's way down the line. You know, when you have a dispute, you go to mediation, essentially. What you really want in terms of relationship engagement is, how do we, with this complex issue we're all trying to focus on, work about how we adjust things and how we change things as we go along, and how we judge that this is going right and this is going wrong, as opposed to pull back to the, you're not performing right, so our contractual remedies check in. Now, you of course need the technical things as background, but in the foreground, you need the relationship things. And over 30 years, honestly, I haven't really seen lawyers really stepping forward and changing the way in which contracts are written. You need to change the attitudes, you change the documentation, and you can capture more of these positive, beneficial ways of working.
Thanks for that. I think to me, kind of what comes out of some of the discussion is really this notion of relationships over contracts, as we suggested, but also really being perhaps more purposeful and proactive about how the language in contracts needs to change to perhaps engender people differently to one another around the table, to allow them to make these kind of collaborative decisions about where projects need to go next. And the fact that perhaps the experience that we're all facing right now under the pandemic is really bringing to light the fact that we don't know how to do that. We don't know how to describe that process very meaningfully. And in fact, that process looks probably fundamentally differently across contracts and projects itself. And so what we can do is perhaps exchange the learning and what has worked where, but it is difficult perhaps to be prescriptive about what it should look like at this point in time. So mindful of time, I would like to go ahead and pivot things over to some of the folks we've got teed up to share exactly with, share what's going on in their world in terms of how their projects have changed and shifted given the current context. So first we'll hear from Hortense, and then we'll hear from Patrick. And so what I will go ahead and do is pass it over to you, Hortense, in terms of talking to us about what's changed, what's been hard about those changes, and sort of what your next big decision points look like at the Cameroon Kangaroo Mother Care project. Over to you.
So thank you very much. So as earlier mentioned, I'm working with the Kangaroo Mother Care project. And in this project, the way COVID has affected us is that we are seeing, we are within hospitals, and being in hospitals means that we have some challenges to our practice of Kangaroo Mother Care, because we are dealing with clinical staff, babies, mothers, and families. And then we are also having to deal with the family that comes from outside the hospitals. And with most of the hospitals being the places where we have to take care of our COVID positive patients, we are seeing a reaction from someone that's being different across the different hospitals that we work with. And when it comes to respecting the guidelines from the government in terms of social distancing, we are also having we are forced to, or compelled to change the way we want to manage consultations where we have larger groups of people. So in this case, for example, we are having to spread our follow-up consultations for babies across the week, so that we have smaller groups of women coming for follow-up appointments. We have women, mothers who are also, because of anxiety and with little knowledge about the way the disease gets transmitted, being worried about bringing their children to hospitals where they think that they could be exposed, and the means of transport. So we are at the point where the need for our services is there. It's how we manage the needs, and all the partners are very conscious about that. And just as we said, we are just looking at how do we, in terms of operationalize within the challenges that we have. So in terms of the mothers who are in our facilities, what we are doing is making sure that they are restricted to the areas where they have to be, that there are no visits from external parties from outside the hospital. Our follow-up visits are also restricted. So mothers are coming with, we have fewer number of mothers. We are looking at adapting teleconsults for some mothers who cannot make it to the hospitals, because They either do not have the means to get to the hospital in a relatively safe way, or they are so worried that they don't want to show up in the hospitals, so that we ensure that there's some level of follow-up for these mothers. And in that sense, we are working with all our facilities. We are working across 10 hospitals to make sure that we are guiding the mothers who are so worried about their babies, but also we are thinking about ourselves as non-clinical staff who are more administrative. We are looking at, just like you spoke about verification, our verification agents who have to do quarterly verification sessions in the hospitals. Because they're non-clinical, again, with guidance from our governance bodies, access has been restricted to those facilities, so we have to derive a different way of measuring what the work that the data, or verifying the data that we collect. So we are at a point where we don't have the luxury of time to kind of pause all our verification to wait for a time when we go back to normal to do the verification. So we have to find a way to do the verification anyway, remotely. So when I speak about partners, recognizing the fact that it's still very important to carry out this service, we understand that we need the funding that will come out of this verification to continue the project. They are then open to listen to what are the options that we can put on the table that can allow us to continue to function regardless of the challenge that we have. So we are looking at partial verification, because as a government, the government of Cameroon is one of the outcomes donors. The government, the government believes that while we have COVID, we do not have to compromise the quality of the work that we are doing. So we cannot, for example, based on just the data that we are getting, but then they have to continue. We have to continuously do some of measuring, some sort of verification that tells us about the quality of the work that has been delivered. So gradually, our partners are trying to find common ground where we still have some level of verification, but in a way that is not impossible to do, or that does not distract us from the real work that we have to do, which is delivering quality service to the babies. So, we are at that point where our different partners are saying, yes, we want to go forward. Our response is we cannot pause, we cannot stop, we have to go on. But how do we go on in a way that we can still continue to function? So those are the discussions that we are having. And with most of the partners being new to development impact bonds, they are really counting on forums like this, and that's why I'm part of this forum, as well as learning from other partners to see how this has managed. This is being managed by other organizations and other institutions, given that this is a global crisis for all of us. And we are, from our last week's conversation, all the partners are saying, yes, we need to do a partial verification. But then if we get to a point where we cannot even be able to get the data out of these facilities, what do we do? And that's where we are discussing the possibility of introducing a pay for service, at least for the time when we cannot be able to collect data. And then if we return to a normal, maybe go back to our an outcomes-based approach in the way we are approaching the project. So those are, that is what we are experiencing right now in the project.
Thank you for that. I actually see Nigel's posted a question. I don't know, Nigel, if you want to clarify what that question is, but it sounds like there's some curiosity around how perhaps you navigate some of those conversations with various partners and how exactly you go about putting forward particular approaches in the project. Have I sort of gotten that accurately, Nigel?
I actually asked that earlier, and I think Hortense has probably covered a lot of it in that contribution. I think it's really interesting to hear that actually the flexibility from the outcome payers that perhaps we're seeing in some parts of the world, notably anyway the UK government, doesn't sound like it's being repeated by the Cameroon government, who still have expectations around the outcomes verification in order to drive payment. I wonder, Hortense, if you simply can't find a way to do that, what happens? Does the service stop, or does the government give in and find a different way to pay you?
So at this point, I think the government interest is just in making sure that there's some quality control. And this is because we, as a continent, I would say when we look at the COVID-19, we are a few weeks behind where the rest of the Europe and America is. But then they're also conscious about the fact that that's why I said, if we get to a point where we still can't do even the remote, we can't even collect the data to be able to do some partial verification, then of course we'll go to that option where we are saying pay for service. As a country, even we are not in a complete lockdown, for example. That only explains that's the reality of the setting where we are, and that is why the decision is, the discussion are still around doing some level of verification. But of course, if we get to a point where we can't do that, then they're open, and that's why we are looking at what do we do for the services that have already been provided, and then what do we do for the services still to be provided in a time when we do not know, there's so much uncertainty around how we can be able to collect data to be able to get outcome payments. So for example, what we have, the services that we have already provided for January to March, we are at the point where we say, let's do some partial verification, because there we know that where we are, we still can do that. And we are saying from April to June, because we are not yet in the peak of the disease in our country, we are anticipating that if we're not able, we're already discussing, do we go for an activity-based approach in the way we run the program? So we are looking at all depending on the circumstances, and we're monitoring closely.
Thank you for that, Hortense. Louise, did you want to jump in as well?
Yes, I was just going to make the observation, I think Hortense has covered it well, that I think, two observations really. One is just to re-emphasize that Cameroon is probably, like many countries in sub-Saharan Africa, are probably 6 to 8 weeks behind where Northern Europe, North America is in terms of disease progression. So whilst we're seeing cases, they're not yet seeing the rapid uplift that we've seen in most of the countries where the participants today are based. I think that brings with it two things, because in addition to the Ministry of Public Health in Cameroon as a counterparty to the contract, we also have two Canada-based organizations who clearly are seeing this play out in their own health systems at the moment, and I think are very conscious of where this may go. I think what's interesting though around the Cameroon government perspective at the moment is that they see a logic at a point where their health system is under strain to continuing to have in place some incentives around the quality of the practice, not just the existence of it. And I think it's important to say that the intervention itself is delivered by clinicians that are employed by public hospitals. So the DIB, if you like, is paying for the training and the continuing professional development and the support that sits around those teams, but the intervention itself is delivered by public employees. And so there is clearly a sort of balance that needs to be found between keeping clinical staff focused on the quality of what they are doing and their practice in neonatal wards, whilst also recognizing the operational strains and pressures that may be increasing over the next couple of months. And as Hortense says, there may come a point where actually it's just simply not appropriate to continue in that way and to try to even gather any data beyond what is absolutely the kind of clinical minimum that is needed. But I think the government view is not irrational where they are at the moment. And I think it's obviously a very different context as well, where there is a lot of external finance beyond this impact bond in the health system, much of which is structured around a performance-based contracts with government. It's not yet clear how those are being reoriented either.
I think it's helpful to understand the sort of imperative of government to both continue to insist on quality as an important thing to do, despite the fact that we're under a pandemic. And actually, I think that's a theme as a ERGO group we are looking to sort of develop a bit more in the session that's coming up on the 22nd. So thank you, Hortense, for sharing that with us. I'd like to now sort of shoot it over to Ian and Patrick, who lead on outcomes contracts in Belgium. Would love for you all to talk about what your experience is in trying to get services to continue in a context where perhaps we are, you know, 6 to 8 weeks ahead of Cameroon. So what's going on in Belgium? Do I have Ian or Patrick? I think maybe someone might be on mute. Ian, I see you, but I think you're on mute. Am I the only one having trouble hearing Ian?
This is Rory. I cannot hear you.
Okay. I don't know if it's your headphones, Ian. Well, we were running technically sound for a while there, so it was only a matter of time until we ran into something like this. Patrick, are you on the line?
Claire, I'm enjoying the irony of where you are right now and where you're with the connection.
The fact that I am actually also dialing in from Belgium right now.
Yeah.
Yeah, although the countryside is very different than Flanders currently. Right, I think, let's see, I'm going to send Ian a quick message.
I can see both Ian and Patrick on video, but...
Yeah, I can too,
right.
Which is why I'm sort of given a bit of time to see if we can't sort this out.
Can I steal the microphone while you're fixing that?
Oh, by all means, go for it.
Right, just a couple of thoughts that I would pull in together to, and I'm reflecting on comments that Eric made in our Pogo group and that Julian has just made, and noting that a lot of our language around procurement and sort of setting up contracts has been, there's been a legacy of a drive towards making public contracting more business-like and sort of commercializing things, and that the UK is looking at what will the new procurement rules be in a sort of post-Brexit world. Currently, the UK is still got legislation that follows the European Procurement Directive, and so I wonder if in the future there is an opportunity to think about public, social services and public contracts in a new way. And I know that everybody in the group has emphasized that there's lots of flexibility already in the procurement rules, but maybe there's an additional opportunity to lean on those important flexibilities or articulate them more. The other thing, though, I wanted to say was that was more focused on the present, and if we have been sort of like thinking about what does business have to bring to the sort of public sector contract stuff, then I would say that the non-profit sector and provided sector needs to take advantage of the things that sort of private commercial contractors will be doing right now. At least in the US, people will be treating this as a change. People will be getting prepared to bill for the changes that are happening in a sort of cost reimbursement type way. And I wonder if we are doing the appropriate job to, as people advising the nonprofit sector and sort of sectors that are more used to grants, to say to funders, this is a new and different world. We need funding to handle this new and different, these changes that are happening, separate from the existing contracts that, the outcome contracts that already exist. In order to figure out how to change those contracts, we've got to figure out this new world, and there should be funding for figuring that out, as well as funding for maintaining the existing networks in this emergency. And I again, just an open question to the group. that, are we doing a good enough job describing that the need in this emergency circumstance, and are we asking clearly to funders for compensation for that?
Thanks for that, Rory. Yeah, interesting to think about how we might leverage sort of the existing experiences of sectors against one another. I'll check back in with Patrick and Ian to see if audio works now.
I logged in again. Do you hear me now?
Ah,
yeah.
Hello. Yeah.
Hello, everyone.
So, tell us about how things are going.
Probably like everywhere, organized chaos. Trying to get some lines into communication and governance, which is a challenge, I must admit. But more specifically, I'm a bit jealous on the UK, because last week, I think it was, on the Pogo group, Rory put a document online from the cabinet, being very clear about how to handle procurement, with very few clear guidelines on the contracts, and that's something we miss in Belgium, because it's very dispersed between the different departments and ministries. Having that said, we're a reasonably large department on a Flemish level, so we have sufficient impact, but nevertheless, some of the challenges at this point are certainly the consistency in the communication and keeping it clear for everyone in our own organization, for first, and secondly for our partners, because our partners always seem to find their way around the official communication channels. So we have to invest as much in our own organization as the partners in communication. Secondly, there's a lot of emotion going around. There's a lot of, I wouldn't say panic, but close to, which makes conversations difficult and not always evenly sensible. Having that said, we did try to get some structure in our communication to partnerships. We have a long-running tradition of paying for outcome and paying for result. But in most contracts, it's partly paying for service and partly paying for result. So in the measures we provided, there were actually 4 points of interest to us as a government. First one was indeed keeping the service going. So we launched a call. Maybe I should have clarified, I work for the employment service. So that gives a bit color to what I'm talking about. So mainly our contracts are about professional training and guidance and coaching. So the first call we launched was to provide maximal digital services. And we had a lot of flexibility on accepting the services. We put out a few guidelines on how to prepare the proposition, and then most of them get started, not all of them. And some of the regulations had to do with safety and with regulation for the unemployed. Second thing we attended to was keeping the cash flow running. So in the measurements we announced, for the trainings and for the coachings, we had contracts on volumes of unemployed that we would send to the partner on a more or less regular basis during several months in the year. And now with the Corona crisis, these figures took a dive, which meant that the payments for service for those partners intended to take a dive too, and so we agreed to keep on paying the same level of service provided, although there were was less performance and there were less participants, knowing that in the months coming after the Corona crisis, we'll have to step up with those figures and level out the payments we did to bridge the cash flow. Another thing we implemented was the message we sent out actually was, please do limit the collateral damage. That meant that from our side, we would not force any solutions that were not feasible for providers or not rentable for providers. So they were able to not get into the proposition of digital service provision. And we asked them to make use of the general measures that were written out by the federal government. And the most important one there is the regulation for technical unemployment. So if they couldn't provide service anymore, we stimulated them to go into technical unemployment, which meant that their workforce is currently on unemployment, but officially still under contract, in order to keep them alive during the Corona crisis. Of course, it doesn't cover all the costs, but up to 70 to 80% of the cost can be put into unemployment in order to keep the partnerships alive. And then the fourth one is fair compensation. And what we set out to do there is not to decide too fast, because you can only measure the costs and the damage after the storm has passed. And while the storm is still going on, it's very difficult to make a fair assessment of compensation for both parties. So we're trying to postpone that unless the lockdown will continue for much longer. Then we will have to provide some compensation in order to keep the partnerships alive. That are the four main points of interest of our government for the partnerships in employment. Then coming to the SIP project, I very much like the reasoning of writing contracts differently, like Julian Blake did. And what we did in our first SIP contract was write a rather open contract. It's not a perfect contract, but we started from the idea change is inevitable, meaning that in our today's world, if you engage yourself for a contract over more than 2 or 3 years, there's bound to change something, and you should prepare for change and prepare for impact. Therefore, we try to design our contract around having an idea of a solution and having it evaluating to a better solution even. Second thing we did in the contract was our result management was built up on a changing economic environment. If you go in a contract over 4 to 5 years, you're almost certain that the moment you start and the moment you end, you will end up in a very different economic situation, being it a better one or a lesser one. So in the SIP, first on the contractual basis, anything can be changed, we are now discussing with our provider because he's a bit reluctant to jump into the digital service provision. So he's still open to not go into digital services, and we'll see where we land there. It's a trajectory of more than a year for each group starting, so they have some time to adjust if the lockdown doesn't take too long. And we'll see where we land there on the provision side. On the payment side, we chose for a relative payment to solution, and I'm very curious to see where we will land with that. To make a long story short on the measurements, in practice, SIPs go for long-term engagement, so results are economic conjuncture sensitive, and should be and the measurement should be likewise. So relative results compared to coincided target groups are preferable to snapshot comparison. Question we asked ourselves is if you have a clearly definable reference group and results are more or less predictable, why would you do a social impact bond? You might as well just pay for outcome. So in a SIP, you probably will not have this reference group. And the solution we came up with together with some partners was to work around this reference group and make an indirect reference group on age, education, origin, gender, and a few other variables that are in our target group. And the target group cannot be defined in our general database, but the characteristics of the target group can be defined in our database. So we made a combination of variables, and then we linked them to the target group. And this target group is equally dependent on economical evolutions and crises, just like the COVID crisis. So what we expect is that if results go down for our SIP, they will probably equally go down for the target group or the kind of target group we defined for the project. So I'm expecting that for the SIP there will not be much adaptation needed. Certainly not for the measuring of the results. But I'm not, of course, not 100% sure because it was designed for economical fluctuation, but this is turning out to be more than just fluctuation. So I'm very curious where the results will end. And at that time, I think there will be enough time to adjust if it's necessary. And we will have a lot of more information on how a crisis like this might implement our way of measuring. I think that's not even in a shell nut what we did in Flanders.
That's been really helpful, Patrick. And I would just flag that cheers to James Ronicle for posting a sort of nice summary perhaps of some of the 4 responses that you articulated, right? So keep the services going, keep the cash flow going, limit the collateral damage, and provide fair compensation. I also think what was interesting as it related to your comments on your SIB project is actually that when you've structured a payment mechanism that is supposed to sort of rise and fall with general economic trends, potentially that is a more robust outcome measure in a crisis time. But TBD, obviously, this is not a normal fluctuation of the employment market. It's a sort of massive change to things. So I appreciate that. We've got about 15 minutes left together, and we've got a number of questions that were sort of fed into this session prior. Rory, I know you had questions for Patrick, so maybe you can connect offline. I've written out some of these questions in the agenda for folks. And so I think what I'd like to do is kind of open it up to comments and reflections as those questions are articulated in the agenda. So in case you don't have it in front of you, really what are folks thinking, and how are people maybe redesigning project outcomes considering COVID-19? You know, why or why not? How are people verifying or reviewing outcomes achievements remotely? This has come up as a consideration for the Cameroon project, but I imagine folks are also trying to think through the same things where, you know, you can think about perhaps some of the youth unemployment services where you're trying to pay on the sort of basis of improved behavior at school, school's not meeting. How do we sort of figure out how that might work? I also had a comment through, I know, Sophie, you wanted to talk maybe a bit around outcomes data and sort of ramifications of outcomes data as it relates to your work on the Pan-London Edge of Care SIB. I don't wonder if maybe some of your comments can pick up on some of the questions we've got on the tail end of this conversation.
Yeah, sure. It will link a little bit to outcomes verifying, but I think it's slightly different, but I'll tag into that.
Sure. Do you want to kick it off?
Oh yeah, sure. So hi everyone, I'm on the board with the Pan-London SIB, which is an Edge of Care SIB. And I guess one of the things that we've been thinking about, and yes, we're facing sort of similar problems that have been discussed, is about the opportunity that might arise from this. And I think it's something around testing interventions. We, similar to as Patrick described, we've switched everything to digital interface. And so we're running sort of quite widely tested therapeutic models over Zoom and WhatsApp and tools like that. And at the moment it's very early days, but we're not modeling too big a change in terms of our outcomes suspected, which may need to change. But I think what could be a really useful sort of industry outcome from everybody is if we can create a database on actually what are the outcomes of face-to-face interaction versus digital interactions, and what are the implications for the future delivery of services. And I think while lots of, we've done some reading around it, trying to sort of do this forecasting, there's sort of lots of sort of interesting sort of studies done or commentary around specific cases. But I think the level of outcomes measuring and the data that's created from outcomes contracts could really do an amazing sort of cross-sector comparison for this. So where SIBs are still on track and delivering, I wonder if there's some sort of collective exercise we can do.
Thanks for that, Sophie. I think definitely everyone seems to be reconciling with how exactly do we measure outcomes in accordance with the contractual terms that we signed on to, or change them, but also do we need to start leveraging perhaps a bespoke or new data collection system for some of the learning that is emerging. Do folks have thoughts on this? How are you thinking about outcomes redesign? What are the kind of questions that you're trying to figure out as they relate to your project? Or do people have brilliant ideas about how we should be collecting data? Patrick, did you want to say something? We've got a hand up from Patrick.
Yes, here I am. Sorry. What I forgot to mention on our result payments, I said we have partly payment for service and payment for result. And what we agreed to do is we have a lot of different results to measure. And we have agreed to apply a kind of index on the calculation of the results, because our contracts are designed in a way that part of the price of the project is always covered with incentive, but the result is part of the price. It's not just a surplus. So we calculate the result we want to obtain, and we take like 60% of the price will be paid as service delivery, and 40% will be paid for example, 65% of the participants, as we want to obtain 65% of results. So the 40% is divided not by the 100% of participants, but by 65. In that way, if a partner gets a better result, he gets an incentive. That's the system how we usually work. But then, of course, if we put out a result of 65% and COVID passes by, the 65% will go down to like maybe 30% or 40%. So we agreed to recalculate the results based on what we see afterwards as possible results for the period being. Is that complicated enough for you?
Well, I think I'm understanding essentially that when you've designed things around perhaps partial incentives, there's a certain amount of reallocation or flex that can happen in accordance to the sort of partial achievement that may or may not be reached under COVID. Hopefully that's an accurate reflection of what you just said.
Yes, and so as our results is based on expected results in a normal situation, we just have to adjust our calculation on that.
Okay. Anyone else on sort of thoughts or approaches to recalibrating outcomes, whether it be payment or actually maybe articulating new outcomes and modifying a contract as needed, maybe particularly in instances where the outcomes that you've identified are just no longer feasible? Louise, I saw your hand shoot up.
Yeah, no, I always got something to say. So, so I guess this is in relation to, you know, the one that I've got my head most in is working very closely with Hortense, who spoke earlier around the Cameroon DIB. And there, one of the things that we had originally been measured against in terms of the program was the percentages of mothers who, after discharge, would come back to the hospital for a checkup. When their baby was 40 weeks of gestational age. So these are preterm babies. This is about making sure that quality of care and quality of nutrition continues after hospital discharge. Now, I think, you know, our sense is, as Hortense mentioned, that we're already seeing high levels of anxiety around about mothers about bringing their babies back. I think there is also quite likely to be restrictions on transport in a few weeks' time, which would mean that just logistically that becomes very difficult. And so one of the things that we're thinking about very hard and talking to partners about there is, you know, to what extent could we be using telephone follow-ups as a proxy, or indeed just including and recognizing those as part of the DIB payment system. But that feels very different, because essentially that's outbound communication from the clinician to the patient, rather than what we had previously been rewarded based on, which was essentially inbound travel of the patient to the clinic. And so we haven't fully kind of figured that through yet in terms of how we're going to treat it, but it feels like that is an example of a metric that is probably appropriate to change. And I think the clinical guidance we're being given is that there are, you know, sensible clinical checks that could be conducted over the phone to really sort of limit, if you like, the face-to-face contact to cases where there's a real urgent clinical need or a worry that's expressed by the mothers. But also, I think, a recognition that during the crisis during the pandemic, actually psychological support to mothers to provide responsive care and to manage their own anxiety is going to be a really important input to the health and well-being of their babies, in a way that maybe we, you know, I guess we had always been there, but actually had not been so explicit or so important perhaps before the crisis hit. So I guess we're rethinking on a number of lines, but it's quite likely we will need to recalibrate both success thresholds and potentially with that, the kind of payments that are attached to that, because it's a very different kind of clinical interaction to the one that we had originally been contracted for.
Yeah, I think an interesting thing to bring out in that is actually there's a number of support services on offer that actually the need for these actually grows potentially under the current context. And so how do you begin to calibrate and understand an outcomes contract in that space where indeed that becomes a more pressing concern in terms of service delivery? So we only have a couple of minutes left, so before I sort of say goodbye to everyone, I want to say thank you for joining. Are there any sort of final comments or questions that folks feel like they really want to get out before we disband? I'll pause and see if any hands go up or anything pops up in the comments, but give it a minute. Steve, I saw your hand go down and then back up again. So did you have something?
Yes, it was just me getting attention.
It worked.
Yeah. One of the things Louise really interestingly brought up, I thought, was that an outcome has more than one component. So in the case of the mother bringing the child back after 4 weeks, there's both the actual appearance of the mother and child gaining the care that they need, but there's also something about measuring the psychological motivation of the mother to engage the healthcare service. And I thought it was interesting that Louise was saying that changing the outcome from the inbound mother to the outbound physician call, potentially there might be something about trying to separate out the components of the outcome so that an outgoing or a phone call could be allied to some other kind of measure which would measure the mother's motivation. So in a sense, you split out the two components of the psychological and the actual physical, and then replace them with two separate things that together could add up to the same thing.
I think that's really insightful. Yeah, I suppose to provide some sort of concluding comments on today's session. What I'm hearing a lot of is around the sort of need to perhaps re-articulate or re-examine the way outcomes are in the contract. And actually that some of that is around exactly as you just suggest, Steve, thinking about how you begin to split and parse and re-articulate meaningful outcomes in a particular context. So I appreciate that comment very much. And I know that's a very live issue, especially for projects in the UK going through Life Chances Fund as they rethink what those outcomes orientations and profiles need to look like. So I think it's been a helpful session. I've taken a bunch of notes. And so what I'll do is clean those and recirculate that so everybody's got a bit of a record of today's chat. Again, thank you so much for joining. Thank you for your participation and jumping in. We'll continue to do these sessions, I think, on a monthly basis or so. So we'll release details from the next round of things at the session that we're hosting on the 22nd of April. So next week on performance and accountability, which I hope you'll find picks up, especially on some of the comments that we got around, you know, we need to be focused on getting things and maintaining service delivery now, but there has to be a sort of monitoring and auditing and quality assurance role that government plays, whether that be post hoc or in the current ongoing relationship with providers. So again, thank you so much for joining. I hope we'll see you on future calls and enjoy the rest of your afternoon. Bye-bye.